Dr. Lee, everybody is talking about the H1N1 flu, and we're talking about flu. It's flu season. What are your recommendations? What do you tell your patients who come in and ask you about this? What should they do?
Well, Nancy, first of all, this has been a discussion since 1977. There has been antigenic variants of influenza A, which would include H1N1, and influenza B, all over the globe. And so we've been tracking this for all these years, and the media has really got its hands around this one this time. And I mean, it's good that the public is informed, but it's also good for them to take a step back and not get mixed up in the chaos of the situation and really make sure that they're informed about the decisions they're going to make, whether they're seeking the vaccine or not. And I think it's very important first that you find out who are the at-risk groups.
So some people are saying, oh, should I get the flu shot? Should I get the H1N1 shot? I'm 65 plus. Should I get it because I'm at risk? My children, should they get it? What are some of the recommendations that you have for those?
You know, the best recommendation I can say, and this is being as neutral as possible, is to say make sure that you as a parent, if you're deciding for your child, or you as an adult, know the pros and cons of receiving the vaccine or not receiving the vaccine and being able to take on those consequences, whatever the outcome may be. In my office, I always ask patients several questions. One, do you have any type of egg hypersensitivity? I know it sounds odd, but I've seen such a huge influx in vaccine reactions because they're reacting to the egg that's inside of the preservative that's used in the vaccine. So you want to make sure, first of all, you don't have any egg hypersensitivities. If you do, you may want to talk to your doctor about other alternatives. The second thing I always tell people is, if you are in a situation where you can use natural medicine, vitamins, and herbs to really boost your immune system, and you're working with a doctor very closely at saying, hey, what are my natural immune defenses? What can I do to protect myself against the flu this season without going the vaccine route? That's always the best way to do it because that's natural and it can be used in almost every circumstance.
Personal question.
Yeah?
Did you get the H1N1 flu shot? You did not.
But you also have to remember, Nancy, first of all, I'm not in a high-risk category. And secondly, this is what I do. I mean, I do this day in and day out to protect myself and my body and my family against these types of viruses, you know. And so I think that I have my finger on the button a little bit more than say, somebody who is not necessarily in my field of medicine. But I think when you're really looking at the situation, these vaccines haven't been thoroughly tested on the back end of things. And I think that that's the big hesitation that people have.
I am pregnant, and they are recommending that pregnant women do get it. There's been 28 deaths in the United States. My concerns are that I don't want to be a guinea pig. I don't want, it's not been tested, so I don't want my baby to be affected by it in any adverse way whatsoever. And also, if I do get the shot, I will most likely have a fever. And how is that going to affect the baby?
Yeah, and I mean, those are all the questions that we receive daily in this practice, which is really, you know, what can we do from an alternative standpoint? And again, I always remain neutral and say, make the decision on your own, because you'd hate to look back either way, either decision that you choose 3 months from now. You wouldn't want to look back and say, oh, well, I interviewed that doctor and she said this and I believed it at the time and it ended up not being right. Yeah. So if you sit at home and you say, hey, I've made this decision to either vaccinate or not vaccinate myself or my children or my elderly folks or whoever it is in your family that you guys are making the decision about, that you feel confident in that decision to do it.
My fear is that this is all getting blown out of proportion. Is that a rational fear?
I think anytime you're dealing with money, big corporations, healthcare, and also just the fear, people, this is something that they're bringing home in our living rooms, you know, and I mean, we can all sit around and say, oh, well, I could be at risk. I mean, most of us are associated with somebody that's either a child or pregnant or over the age of 65. I don't know very many people that don't fall outside of that category, at least knowing somebody. So I think that this is something that's very personal, and I think that that's why the media is on top of this. And so I would just encourage your viewers to really do their due diligence before they make any big decisions.
Yeah, and if they choose alternative medicine, to come to you and you can help us boost our immune system.
Absolutely.
Okay. Thank you, Dr. Lee.
Okay, thank you, Nancy.